Somebody asked me before I started speaking, they said, what are you going to talk about tonight? And I said, I'm going to talk about health. And health is a broad term because we all know something about health. It just so happens that some people went to school for a little bit longer than others, and I was one of those people that did. Interestingly enough, my first grade teacher said I was too stupid to read. First grade teacher said I was too stupid to read. My mom's a teacher, special ed teacher with a master's degree. My dad is also a teacher with a master's degree. So needless to say, they transferred me to a different school, and as things would happen, I kept after it, and here we are today. So everybody's got something within them that makes them tick. And when we talk about health, everybody's got this potential inside of them that makes them healthy, right? So I think about us being a lot like the acorn. The acorn at the right time in the right place seeds itself in the soil. Given a long enough period of time, that acorn becomes the oak tree. And what does the oak tree have to do with health? What do we have in common with the oak tree? Well, the oak tree has this propensity to heal itself. You cut off a branch, another branch wants to grow. You cut off a leaf, leaf falls, next year leaf grows. The oak tree's alive. Organic matter, us humans, we're alive. So if a human has an injury, the body wants to take care of itself. There's a potential inside of the body that wants to take care of itself. And so what we're going to talk about tonight is the potential that's inside of your body to heal itself, because your body has this natural mechanism, this natural propensity, innate ability to heal itself. So who am I and why should you care? My name is Dr. Michael Lee. I'm the founder of Crossroads Brain and Spine. I'm the clinic director of Disc Center Indy. Just recently, I was voted top 5 decompression doctors in the United States. And much to my first grade, thank you. Much to my first grade teacher's chagrin, I actually authored a textbook educating other doctors across the world about some of the technology that I use in my office. So when the book came out, I wanted to sign a copy and send it to my first grade teacher and tell her that little Michael's not too stupid to read. But I said, let's just focus on the good and not focus on the bad. So you're probably asking yourself a question. I'm asking myself a question. I'm not sure if this is for you, but have we ever found ourselves between a rock and a hard place? When we go through our life, there's sometimes that we find ourselves through a rock and a hard place, and I also have found myself through a rock and a hard place. And this may not be for you, but it may be for somebody that you know. Maybe it's for somebody that you know because 80% of Americans deal with low back pain. 80%. I mean, you do the math in the room, several people in this room right now are dealing with back pain. In fact, it's the most common disability for anybody that's under 45 years of age. It costs Americans $100 billion a year, just back pain. One single diagnosis costs $100 billion a year, and 1 million Americans every single year undergo a back surgery. When we think about being an American, about how good our health system is here in America, and I think, is it really that good? She's shaking her head, no, yeah. Statistically speaking, back surgery is 5 times more common in the United States than it is in the United Kingdom. 5 times more likely here than it is there. And interestingly enough, in 2002, there was an article that came out that said Americans that have a back surgery, 72% of them have a second back surgery. So now that $100 billion, now we're tacking on a few more zeros. And if you're like me, you'll want to know why. Why is back pain affecting 80% of Americans? Why are 1 million Americans heading into back surgery every single year? Well, we talk about the cause versus the effect. And so my question is, are addictive opiates, risky injections, and unnecessary surgeries, are those going after the cause, or are they going after the effect? Our body is a lot like a car. If a check engine light comes on in a car, if you put a piece of tape over the check engine light, you don't see it, but there's still a mechanical problem. So my question about addictive opiates, risky injections, unnecessary surgeries, cause versus the effect. And I think we could probably realistically come to the answer that it's treating the effect, it's not treating the cause. 75 to 80% of specialists believe and understand that the cause of back pain comes from one single area in our body. It comes from the disc. And what is the disc? Well, the disc acts like a shock absorber. The disc absorbs pressure. The disc allows our body to move, and it acts as a spacer in between the vertebrae. A disc in your back works a lot like a shoe on your foot. If you don't have a shoe on and you go walk on rocks, it's probably going to hurt. But if you put a new shoe on, now you can walk for miles and miles and miles and not feel any pain. When the shoe starts to wear down and the shoe has a hole in it, we just go buy a new shoe. Unfortunately, we can't go buy a new disc, right? Surgeons want you to believe that you can, but we obviously know that we're born with what we're born with, and when it wears out, there's only so many things that we can do. Uniqueness about the disc is there's no blood supply. Think about this. If I have a cut on my arm, it starts to bleed, right? That blood creates a scab. That scab leads to healing. Your disc doesn't have that ability to heal. The disc doesn't have any internal nerves. So a lot of people go through their life and they say, oh, I was okay until I woke up and then I had back pain. Did you, or was there already something going wrong and that there wasn't any nerves to send pain signals to the brain? That's what happens within the disc. The disc, just like the oak tree, has an active mechanism for self-repair. There's a natural pump mechanism, and we're going to talk about the pump mechanism, and interestingly enough, the disc is made up of about 86% water. We as humans are made of about 86% water. Well, so is the disc, and that natural pump mechanism helps pump fluid, water, nutrients, hydration back into that disc. If we're dehydrated, we drink water. Your disc can't tell you to go drink water. If your disc starts to dehydrate, it starts to degenerate. And all disc injuries have similarities. They've lost their ability to stay healthy and hydrated. There's a failure of that natural pump mechanism, which can lead to degeneration, bulges, and herniations. And we've probably all heard about somebody that's had bulges or herniations. Just tonight, somebody came up to me and said, I've had a herniated disc. And that's just in this small group of people, right? So think about your disc like the tire in your car. You go buy a brand new set of tires, the tread is nice and thick and it's healthy, right? If the disc stays full of air, if the tire stays full of air, then the tire, you can drive thousands of miles on that tire. But what happens when the tread starts to wear down? The tire starts to bulge. If it loses pressure, air pressure, the tire starts to bulge. Your disc can do the exact same thing. If the metal on the tire starts to show, then that's not good. You can blow your tire out. Well, easily enough, just like buying a shoe, you can go buy a new set of tires for your car. You can't go buy a new set of discs for your spine. So just like as the metal starts to show through on the tire, the metal can start to show through on the spine, and that's when we have a herniation, which we talked about when we first started, right? So what causes this natural pump mechanism to fail? The easy answer is stress. We all know how stress affects the body. But broken down, there's physical stressors, there's chemical stressors, and there's psychological stressors. I've broken them down to call them the thoughts, the traumas, and the toxins. The traumas are easy. That's what everybody thinks about. That's the degeneration, that's the aging process, maybe a car accident or a sports an injury. Maybe the toxins, the chemicals, smoking, alcohol, poor diet, maybe it's prescription medications that are causing that process to break down. And of course we know chronic emotional stress runs havoc on the body, right? And that can come from poor work ergonomics, sitting too long, standing too long, too much activity, not enough activity, or just not enough rest. So what's our current approach to healthcare? What's our current approach to back pain? You go to the doctor and the doctor prescribes you some medications, right? It's easy. Here's a script, take it to CVS, take these drugs, you're gonna feel better. Cause versus effect. Probably the effect, right? If the medications don't work, then you go to physical therapy. And so many times we go to physical therapy and physical therapy doesn't work. So you drugs, you go to physical therapy, and then after physical therapy, you get a cortisone injection or you get an epidural injection. But what if that doesn't work? I mean, 1 million Americans every single year going in to have back surgery. That means that drugs, physical therapy, injections aren't working. That leads us to go have a back surgery, right? And nobody wants to have a back surgery. So the current approach is drugs, injections, and surgery. My thought has always been, well, what if we can just step away from that? Just like the matches, if we pull one of the matches away, we break the chain reaction. We can stop that dead in its tracks and save $100 billion a year. I don't know about you, but if $100 billion is sitting on the table, I mean, that's a lot of money that we're spending on something that we don't necessarily have to have. So my next question to you is, how open-minded would you be to swimming upstream? How open-minded would you be to going against the grain of saying, you know what, maybe there is a different way besides drugs, injections, and surgeries, right? How would you feel, my next question, how would you feel if I could show you a different way without addictive opiates, risky injections, and unnecessary surgeries? But don't take my word for it. This patient left me a review and they said, I am grateful to Dr. Lee for alleviating the constant excruciating pain that I've been suffering with for 20 years. 20 years. I have sciatic nerve problems, degenerative disc disease, and have tried everything. He was my last resort before going under the knife. Hearing a similar story? I got immediate relief on my first visit and was actually able to walk without a wheelchair or a cane. His personal interaction assured me that I could trust his professional experience. I would definitely recommend my friends. Thank you, Dr. Lee. I cannot wait for my next appointment. You think this person's life was changed? Well, this person happens to be sitting in this room. Look at him. Yeah. Look at that smile. When William came to my office, he was walking with a cane. And I said, okay, well, either you're 90 years old and you don't age very well, or you have something going wrong with your disc, right? So within a month, I was able to help William get off of his cane. How did I do that? I'm going to show you. So just imagine, just like William, what your life could be like if you could have your life back and I could save you thousands of dollars in the process. Would that be of interest to you if you could realize health like you hadn't before? So just imagine what your life may be like if you could get back to the activities that matter most. Maybe it's playing with your grandkids. Maybe it's hanging out with friends. Maybe it's exercising. Maybe it's, I don't know, living life without pain. That's a novel idea, right? So just imagine what your life could be like if you could get back to that. Would it be worth it to you? Would it be worth your time? And would it be worth your money? You can't get back time, but you can always make some more money. So would it be worth it if I could show you a way, if I could show you a better way? And you're probably asking yourself, well, when would be a good time in order to do that? Because we talk about time and money. Those are two very limited resources, right? People people come to me every single day and they say, well, I don't have enough time. I can't come to your office because there's not enough time. And I said, yeah, I bet you don't have enough time to blow up the tires on your car if the tire pressure gauge shows up. And I said, how much time would you have when the tire blows out on the side of the road? I bet you have time to get your tires changed then. Now, what if the disc in your back blows? I bet you have time for the emergency room then, because everybody has time for the emergency room, right? And so people say, well, medical care is so expensive. You think it's expensive, go to the emergency room and have them operate on your back. And we'll talk about the finances of back pain. So my question is, yeah, you know. So my question is, how many of you or how many people do you know have had low back pain? Maybe okay, so that's over 50% of the room. William, you don't count because you're under treatment. Okay. You had back pain. How many people do you know or do you have neck pain? Maybe you have radiating pain down your arms or your legs. Maybe you have numbness, burning, tingling in your hands or your feet. Maybe you have weakness in your arms and your hands or your feet and your legs. Maybe you're unable to stand or walk for a long period of time. How many people have been told that they've had disc herniations? How many people have been told they have disc bulges or sciatica or degenerative disc disease or spinal canal stenosis? That's conditions I deal with every single day. And everybody knows what sciatica feels like. It's horrible. It's debilitating. You can't live your normal life if you got this numbness, burning, tingling radiating down your leg. Or maybe you have a herniated disc. Or maybe you have pain coming from degeneration going on in your spine. There's a common thread here. Everybody gets slapped with a diagnosis: disc bulge, disc herniation, sciatica, stenosis, drugs, injections, surgery. Those are your only options. Well, William is a living testament that that's not your only option, right? How many of those people that you know, or how many of you have had an MRI and an X-ray? Maybe you've been to a chiropractor, right? Maybe you've had acupuncture. Maybe you've done physical therapy. Maybe you've had the cortisone injection. Maybe you've had the epidural injections. Well, the people that are saying yes and are the same people that raise their hand to, oh yeah, I have sciatica. I have weakness in my legs. Well, if drugs, injections, and surgeries were going to help that, then the room would be quiet. But the room's not quiet, meaning that it doesn't work. So my next question is, what do we currently know about spine surgery? We know that 50% of spine surgeries fail. 50%. That's a coin toss. Flip a coin. Maybe you're better, maybe you're not. 50% of spine surgeries fail. A successful spine surgery is deemed by 30% reduction of symptoms. So 50% are successful. So let's say you're one of the lucky ones. You flip a coin. Hey, I'm lucky. Your pain's a 10 out of 10. Now it's a 7 out of 10. 7 out of 10 pain is still pretty bad, right? And of those people that have had a spine surgery, 72% of them are likely to have another one. It's the chain reaction. We got to figure out a better way to step away from the chain reaction. So as I see it, there's really two types of people. There's two types of people that say, this is the way that's always been done and this is the way we're going to continue to do it, or there's got to be a better way. William said there's got to be a better way. He found me and now he doesn't have a cane. There's got to be a better way. William was open-minded to trying something different. And those are the patients that come to see me because they're tired of being kicked down the curb and every doctor says, oh, take this medication, try this injection, go here, go here. You got to be open-minded to trying something different. So if you trust him, you're probably going to trust me too, right? Right? Because if he's as trusted in the community as he is when we're talking about spiritual direction, well, wouldn't we trust him the same thing with our health? Right? Yeah. If you're like him, you won't be disappointed. Or if you're like her, you won't be disappointed. Or him, or him, or her, or her, or her, or her, or him. I take care of people every single day. Numbness, burning, tingling, sciatica, stenosis, bulging disc, herniated disc. Every single day I help people just like that. Oh, and I also help people like her. But don't worry. I know you have a lot of questions. I've been talking about a lot. You're kind of drinking from a fire hose. You have a lot of questions. Most people ask me 3 questions. They ask me, number 1, how does this work? Number 2, how much time is this going to take? And really, number 3, which is the biggie, how much is this going to cost? Right? But I have exciting news. I can help. If I can help William that came to me in a cane, I can help you too. So here are my top 3 secrets that I help people avoid spine surgery with. Number 1 is digital infrared paraspinal thermography. Hey doc, what the heck does that mean? I use a technology in my office that I can mathematically, objectively measure inflammation within the spine. Inflammation, pain, condition, and issue, they work hand in hand. Hey, I don't feel good, I take my temperature with a thermometer. If you have a fever, then we know that something's wrong. I can do the same technology with your spine. If you have a fever in your spine, we know that your spine's not working well. That's the book that I wrote. I spent the first 2 years of my practice writing a textbook on this technology to educate doctors from across the world on, hey, we need to use this in our practice. So that's my first secret, is this technology. The second secret, and this is William's favorite, the Class 4 infrared laser. The great thing about the Class 4 infrared laser is it's FDA approved. And William, what's the biggest side effect Biggest side effect of the laser in the office, I'm going to answer that for him. It's less pain. William comes in, he's like, hey, can I get that twice? It feels so good. Can I take this home? And I said, William, for a small fee, I can have this shipped to your house. I can make a home visit. That's not a problem. So that's the second secret of avoiding spine surgery. Number 1 is the infrared thermography. Number 2 is the class 4 laser that's FDA approved for decreased pain, decreased inflammation. Number 3, and probably the best thing that I have in my toolbox, is the non-surgical spinal decompression. And there's a couple people here that have been in my office and seen this live and how this works. And the cool thing about this technology is it helps heal that natural pump mechanism. Tries to pump fluid back inside the disc. If you have a flat tire or you have a tire that's losing air, the only thing that you can do is put more air in the tire, right? If you have a disc issue, a bulging disc, a herniated disc, the only thing that's going to help that disc heal is to put water back in the disc. It's really that simple. We got to pump water back in the disc. We're made up of 86% water. The disc is made up of 86% water. This technology does it. And it just so happens that there's 1,200 of these non-surgical spinal decompression tables across the country. 60% of them are used by medical doctors. Chiropractors don't use this technology. Chiropractors want to manipulate your spine and get the popping and the snapping. We're not talking about joints, we're talking about a disc. This technology helps pump fluid, water, nutrition back inside the disc, and across the country, there's an 88 to 92% success rate with this type of treatment. Surgery's 50, and that's a surgery. I mean, we're talking about someone going in and putting hardware and nuts and bolts and plates inside your spine. 50% successful. And if it is successful, it's 30% reduction of symptoms. Success rate of this is 88 to 92% across the country. So success breeds success, right? Question number 2 is, how long is this going to take? Well, I've developed my own methodology of treating patients like this every single day. I've done 2,600 treatments in my office, and I've developed a system that takes people from unhealthy to healthy. I have to have surgery, I don't have to have surgery. I'm addicted to opiates, I'm not addicted to opiates. I have to have injections of my spine, I no longer have to have injections of my spine. But it takes time. If it takes time for the acorn to become the oak tree, doesn't it take time? Wouldn't it make sense to go from unhealthy to healthy? It takes time. All processes take time. And that's what everybody wants to expedite. Everybody wants a quick fix. Health takes time. I think about my wife is pregnant. My wife is 13 weeks pregnant. She can't speed it up. She's due in April. She can't say, all right, I'm growing a baby faster. I'm growing a brain faster. Lungs, heart, lung, liver, kidney, colon, right? All this stuff, you can't make it speed up. Health takes time. The third and probably the most important question, how much is this going to cost? Money is a big thing, right? We all deal with money. In this economy, we're all worried about money. So according to the statistics, based off the National Library of Medicine, a discectomy, which is the lowest level spine surgery that we could do, it's the easiest, $19,000. And that's just a surgery. That's just the surgery. If we go and have a spinal fusion, how many people know somebody with a fusion? Okay, 1, 2, 3, 4, 5, 6. 60 times 6, that's 6 times 6, that's $3.6 million. Just for a surgery. Now let's say we have a laminectomy. Does anybody know somebody with a laminectomy? Okay, we're saving money there. Okay, we've only spent $3.6 million. That's okay. But $60,000 just for the surgery. What we're not taking into account of how much out-of-pocket costs for our medications. How much out-of-pocket costs for physical therapy. Because no matter how good your insurance is, there's still an out-of-pocket cost. There's something called a copay. There's a deductible, right? You have to pay money. So physical therapy costs money. Hospital fees to go in and have a spine surgery, that costs money. What about time off work? what are the statistics on time off work from people that, hey, I can't go into work because I had a spine surgery? I mean, now we're talking probably tens of millions, and any post-surgical complications that we may have. All this is on top of the $60,000 that we talked about with the surgery, right? So my insurance is great, my copay, great, right? Well, let's say that we talked about a fusion. There was 6 people that knew somebody with a fusion. Let's say my copay's 20%. Is it okay if we talk a little money? Let's say my copay's 20%. 20% of 60K, 12 grand. That means you have to go in your IRA, your 401k. You have to refi your house. You gotta sell your car. For 12 grand, that's up front, right? There's still a copay, 12,000 bucks. $12,000 is a lot of money, right? Now let's say we have a copay at 30%, 12 grand to 18 grand. Now the costs just keep racking up. Hey, William, did it cost you $85,000 to get your life back? No. Hey, William, did it cost you $60,000 to get your life back? No. Hey, William, did it cost you $19,000 to get your life back? So I can show you a better way and save you thousands of dollars in the process. I mean, most of the times people say, even if they have a discectomy, it's $3,800 bucks. What about all the other fees? There's a 50% chance this is going to work. So you throw $3,800 down on the table, 50-50 chance it's not going to work. Statistics are statistics, right? So what happens next? If you answered yes to any of these questions, or you know somebody that will have answered yes to the low back pain, to the neck pain, to the radiating pain down the arms or the legs, or the numbness or the burning or the tingling, or the inability to walk or stand for a long period of time. If you or someone that you know answered yes to the disc herniations, disc bulges, sciatica, degenerative disc disease, spinal canal stenosis, or if you answered yes to the MRIs or the x-rays, the chiropractic, the acupuncture, the physical therapy, the cortisone injections, the epidural injections, if you or someone that you know answered yes to those questions, I can help. And I know that I can help because I've done this over 2,600 times and this treatment works. Don't believe me? Just ask William.